Welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead. Today I want to talk about a subject that's very hot for me, and that is what happens when someone who is living with chronic pain goes in to get help and all of a sudden they get accused of being drug-seeking or med-seeking, or they're imagining it, they're being histrionic, they're making it up, they're just trying to manipulate the system. These are just some of the shaming and blaming statements that I've heard over the years. Now, these kind of statements come from all levels of providers. I've heard it in hospital settings from doctors and nurses and other techs and other people working in the hospital. I've heard it in addiction treatment programs from addiction treatment professionals. I've heard it from licensed healthcare mental health workers. And I've heard it from people in the rooms of recovery. And this has got to stop. I mean, there are probably a small percentage of people that are giving the rest a black eye, so to speak. Unfortunately, though, many people who are living with debilitating chronic pain and end up suffering, they need support and help, not shamed and blamed. They also need to know that when they go to a support group because they've had a problem in the past with alcohol and other drugs, that people in that program won't be trying to play doctor, especially the words of wisdom that say, well, don't take nothing no matter what, now you're in recovery. You know, overall that can be very good counsel for some issues for some people. But when people have a physiological or an emotional, psychological reason for being on appropriate medication prescribed by appropriate healthcare providers, they should not be getting medical advice at their self-help meetings. You know, both Narcotics Anonymous and Alcoholics Anonymous have conference-approved literature that warns the members not to play doctor. It says some of our members may need to be on appropriate medication prescribed by appropriate prescribers for legitimate reasons. This material was written by recovering physicians, most of them who are also certified in addiction medicine. You know, I just really want to get the word out to please stop the shaming and blaming. It goes along with this war on drugs mentality that has got moved over into the pain management. There's a lot of pain patients across this country of ours who are not getting adequate relief due to this. Unfortunately, I do see the other side also. I see too many people being over-medicated or given the wrong type of medication and end up having serious problems, including addiction, because of that medication. Let's find the middle ground. If you're watching this on YouTube, please go to the link below to our Freedom from Suffering Now blog, where you will see even more information and about one of my patients and what happened to her and how she almost had a really, really lethal experience. And in addition, I want to let people know that if you are someone living with chronic pain or someone working with people with chronic pain who have coexisting problems, including addiction, on April 9th through 11th, I'm offering a 20-hour experiential workshop on managing pain and coexisting disorders using my addiction-free pain management system. And if you're watching this on YouTube, please go to the link below and check this out. If you're seeing this on my recovery blog on Freedom from Suffering Now, please go to the end of the blog and you'll see a link there. I want to remind everyone that freedom from suffering should be everyone's right. And I do agree too that it needs to be everyone's responsibility. Have a great day and please check back often.